Iwana, you're gonna be the camera person?
Yes.
Okay. Okay. So this is a complex surgical device. It is called a flexible endoscope. It is a colonoscope. So when you're playing with it, don't see if you can see into your mouth, because that's just gross. But if you look through here, this part, you can see that. You can see Iwana right now? Okay. So they use these kind of devices for looking into deep, dark cavities inside the human body. This one happens to be long enough to go into the colon. They also make flexible endoscopes that just go into the bladder, or maybe through the bladder and into the ureter and get a visualization inside the kidney. Most people know somebody who or had themselves a EGD scope to see if they have celiac disease, right? So there's an EGD scope. It goes all the way into the first part of the small intestine called the duodenum or duodenum. Okay, so these are very complex. Watch the end here as I twist these knobs. Okay, so what's happening in here there are cables inside of the device that go all the way, they wrap around a spindle here, and then they go through here, and they attach here, the same way a muscle is attached to one bone and then another, so except for these bones spin, right? This is a very complex instrument. If you look in your instrument resource manual, there is, in a chapter about flexible endoscopes and T-probes, it does show a nice cutaway picture of what's happening in here. There's a lot of detail. There's a lot of, there's moving parts, but there's also spaces. And it is those spaces that cause a great concern for us as far as infection control. This goes into the colon, and even if it went into the mouth and then into the small intestine, it's still going to a place that's not clean. It can pick up dangerous bacteria from one patient and then deliver them to the next. So we need to make sure that these are clean. We'll use things like this brush. We will do things like detach these buttons and use the correct size brush to clean these. They make kits, they sell kits. Sorry about the math. I'll edit that out. They sell kits that have brushes, maybe a brush like this, and then a couple different brushes for these, and then brushes for these, all different sizes. So what's going to end up happening to this scope is it's going to get used on a patient, and then it's going to get cleaned and enzymatic, and then it's going to get high-level disinfected, and then it's going to hang dry in a closed locker, but not sterile, because high-level disinfection and sterilization are not the same thing. High-level disinfection will kill all the vegetative bacteria and some spores. Sterilization is supposed to wipe out everything. Okay, and this is generally considered to be sufficient, the high-level disinfection, because it's going into a dirty area anyway. It's going into a semi-critical area. But then if they're using this to do more than just look, and trust me, they are, when they're doing a colonoscope, they're probably also going to be grabbing a polyp. And that means they're going to stick instruments through here. They're going to come out that end. This is a cleaning brush, obviously.
That goes all the way through.
All the way through. Watch it come up there. This cleaning brush is for removing anything that the scope should pick up, which, considering it's a colonoscope, we know what the scope is picking up, in addition to blood. So, if this is a surgical instrument, it is going to cut into a sterile area. The colon, inside the colon itself is not sterile, but the bloodstream is. So, once that cut is made, any bacteria can transfer from the scope into the cut and make the patient sick. The scope itself only needs to be high-level disinfected according to the Spalding classification system because of the area it's going into, but the instruments, because they're meant to cut into flesh and then go into a sterile area, they have to be sterile. High-level disinfected, instruments sterile. That is something that is spoken of in
Chapter 9, I think.
9,
Yeah.
and also in some other places in the book. But there is a lot of detail to cleaning one of these. There's a magical document called an IFU that you want to follow. Sometimes the IFU is not always good enough. As a matter of fact, several years back, there was some problem with some EGD scopes that were being not sufficiently cleaned, and yet the IFU was being followed. So what happened was all the scope manufacturers updated their IFUs. So on an EGD scope, there's a little part here called an elevator. It's meant for directing the angle of the instrument. And that was not being sufficiently cleaned, and so it was able to pass to hide microorganisms. If you are ever asked to go into cleaning a flexible scope, you need to have training in flexible endoscopes, and you need to be signed off on competencies on flexible endoscopes. And really, it doesn't matter what type of flexible endoscope it is. They're all going into the human body, and you need to show that you are able to do it and you understand all of the risk associated with it and all of the details. So that's it. We can cut that off now.